COVID-19 stands for Coronavirus Disease 2019 is what it stands for. And the intention with that name is to help people understand both when this disease arose, that it's a new coronavirus and that it actually causes disease in humans, and also to differentiate it from other ones like the ones that cause the SARS disease and other MERS disease that are caused by coronaviruses. And when we name diseases like this, we're very careful to try and avoid creating any kind of stigma and attaching it to a place or to a country or even to a person. Because in the past, sometimes diseases were named that way, but that doesn't help sometimes as you want to foster global understanding and cooperation. Well, my first impression when I landed, as I came out of the airplane into Beijing airport, I found this empty airport in a city of 20 million people, and it suddenly brought alive for me just a tremendous cost for the Chinese people, the Chinese economy, this terrible disease. Because when you walk into an airport like that, which is empty, it's a sudden and striking realization of what this disease can do to a country, to a capital city like Beijing. So that was very, very important. Even as I drove in from the city or from the airport, we saw the same thing. It took minutes to drive from the airport in Beijing when it normally takes hours. And that might be great for me for my quick visit, but it's not great for China. And so I was very, very concerned the moment I got off the plane. I was more concerned even than when I got on the plane, because I suddenly realized the impact of this. I was never afraid of contracting the COVID-19 disease in China, because there are measures that you can take to protect yourself and you can be safe. You know, I washed my hands all the time while I was there. I wore a mask as I was requested by the government, by the public health officials, by the people. People wanted me to wear a mask, actually, not the government. And then, of course, the social distancing. In our meeting rooms, we were 1 meter or 2 meters away from each other. When we had lunch, we either ate in our hotel rooms alone, or else we ate on separate tables, even when we were at the CDC. So we maintained the social distance. We also knew what we should be looking for: fever, cough, not a cold or a runny nose. So we were well educated. But then we also made sure that in all of our travels, and I was in many, many places in China in those 2 weeks, we never came in direct contact with patients. We never came in direct contact with the contacts of patients. We just followed all the good measures that were recommended by the government of China and the public health officials of China. Well, I think the important thing, masks play an important role in preventing COVID disease. The patients obviously have got to wear masks when they're in contact with people who don't have the disease. The health workers have to wear masks. And of course, probably for the contacts, it may be a good idea, because a certain proportion of them are going to become cases as well. The question then becomes the general population. And there it's always a balance. You're looking at the balance between how much of a difference it will do, but also the cost of wearing the mask, because you can have shortages which compromise getting them into the hands of people who really need them. But people often say to me, so was that a mistake in China, and did it make any difference? And I say, well, look, we have never before in history put masks on 1.4 billion people and looked at the effect. So this is something we have to study and learn from as we go forward. There were 3 big things we were interested in going to China, and for which we're so grateful for the invitation and for the initiative of at the level of your president, President Xi Jinping, to have a team come. You know, our thinking in infectious diseases, these kind of viruses, they move so fast that using case-finding contact tracing won't work. You need a vaccine or something else. And China proved through a disciplined, rigorous approach that you could actually turn it around with these measures. And we needed to study that and look at that and say, what's really going on? And so those were the 3 big things: severity, transmissibility, and impact of control measures, because that would help us inform and talk to the rest of the world as the disease spread. And while I was in China, the Chinese public health officials, they kept pushing this point with me, saying it has to be a tailored approach to the kind of transmission you have, how much disease, what the capacities are, etc. So that was a big message we took away. But the single biggest message I took away was speed. You have to find the cases quickly, and you have to get them isolated and their close contacts quarantined to be able to break this disease. So that was the first big message. Speed, speed, speed. And the second big message that I got was you can't get speed without your population. Your population has to understand the disease, understand how serious it is, and understand how to get family or loved ones or work colleagues tested if they think they have the disease. And China worked hard to remove the barriers. Remember, the government said, outside China, everybody thinks, insurance covers everybody, medical insurance, and they don't realize it's actually way more complicated than that. And but early in the outbreak, China's government said, look, when your insurance stops, the state steps in to cover the costs. And that's important to helping people know, if I get tested and I'm positive, I'm not going to go bankrupt or have a financial catastrophe. And that's another important message for the West. But the big ones were about speed and use your population, because that's your surveillance system. But you have to bring them with you to understand this. And when I was in China, I was so impressed by, the government did great things, but what really impressed me were the people of China. There was a sense of societal responsibility and sense of duty to play your part. And of course, some people aren't going to feel that way, but the overwhelming proportion did. And it was a striking and very, very special thing about China, and something that really touched me. So I think there were two things working for China in this outbreak. One very recent and one very ancient. You have a culture which goes back through centuries and eons almost, and over time there's a wonderful sense of the importance of society as evolved in Chinese society and in much of the East, of course, and it's quite different from the West, where individual rules and their society rules to a certain degree. So that's something which has happened over so many centuries. This wonderful culture has evolved. But at the same time, since the time of SARS, you have really strengthened the public health capacities in the country. So that culture, combined with the public health capacities that you had that understood how to deal with dangerous diseases like SARS, could then be mobilized very, very rapidly. So when you brought that public health expertise together with the population and some pretty strong leadership and big decision-making from the people at the top, you had the combination you need to beat a virus and a disease like COVID-19. So one of the things we talk about in our report is China was sort of the first line of defense for international spread of this virus. And it did spread out of China, of course, but then China very, very rapidly got control of that situation, and we didn't see further spread out of Wuhan or out of China to the rest of the world. And then the second line of defense becomes those countries that then became infected next. And I think one of the great things of China was it was willing to share its experience, share what it learned with the rest of the world, very, very openly, very transparently in what we saw. Our mission was allowed to look at whatever we wanted. You can always be more transparent, people will say, but we saw enough to understand the fundamentals that we needed.